I'm so glad that you are here on behalf of the Southeast Prevention Technology Transfer Center, also known as the Southeast PTTC. Say that 10 times. We are so glad you're here. The presentation today is titled Building Bridges, Fostering Community Campus Collaboration for Substance Use Prevention, Harm Reduction, and Recovery. And we have an amazing panel of speakers today that will be introduced in just a couple minutes. My name is Amber Jones. I'm a project manager and coordinator for the Southeast PTTC. And I'm going to do some housekeeping and then hand it over to one of the faculty that is a part of our team. If you are joining, if you can kindly please mute yourself, that would be great. I'm going to tell you a little bit about the PTTC and then we'll go ahead and get started. So we are required to always talk about the disclaimer. The Southeast PTTC and the other centers across the network are 100% funded by SAMHSA, the Substance Abuse and Mental Health Administration. The contents you're going to hear today from our presenters don't necessarily reflect the official views or positions of SAMHSA or the U.S. government. And my PowerPoint is having issues advancing. So the PTTC network welcomes and celebrates our diverse community of professionals. We strive for inclusivity that respects the spectrum of identities and backgrounds. To that end, the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. So a little bit about our network. We have 10 domestic regional centers. We are region 4 in the dark blue. There's 8 states that we provide training and technical services to. And then you can see the other centers across the United States. We are housed at Wake Forest School of Medicine and led by our co-directors, Dr. Wagner and Dr. Woofson. So a little housekeeping. After the webinar today, we kindly ask that you please fill out the evaluation form. We really do value your feedback, and we use this feedback to help inform and plan the webinars that we provide to those that utilize our services. So please take the time to fill out that evaluation form. When you log off of WebEx, it will come to a slide on your screen that will say you're going to an external site. Please, you can push that saying, yep, it's okay, I'm going to an external site, and then you'll get the evaluation form. After you complete the evaluation form, you will get the fillable certificate of attendance. So please do that evaluation form in order to receive your certificate of attendance. And we will also, at the end of the webinar, show you a link that you can get to the evaluation form if for any fact that it doesn't pop up on your screen. And if you have any questions regarding that, please let us know. All right, if you aren't already a part of our listserv, please join us. We have some awesome events. I'm not going to go into detail, but please check out our website. Here are some events that we have planned in the next couple of months. We have a collaborative event with our other TTTCs, and then we also have a youth engagement series and a grant writing series. So with that being said, I'm going to hand it over to Dr. Kate Egan. She is faculty here at Wake Forest School of Medicine, and she also is on this project. And she has worked really hard to bring in the amazing speakers that we have lined up for you today. So I am going to pass it over to Dr. Egan.
Thank you, Amber. I'm just going to briefly set the stage before turning it over to the panelists today. So kind of talking about the epidemiology and kind of the data behind why we're here today. We know that substance use rates are declining kind of by generation for youth and young adults. And we also know that emerging adulthood is a high-risk time for experimentation with substances. Colleges, going off to college offers a new experience where you have new freedom, also a lot of new resources that we'll learn about today. But one statistic that's relatively new, that's really concerning, is that we're seeing this substantial increase in drug overdose deaths among 10 to 19-year-olds. So even though rates of substance use are declining, we have recently seen this spike and really adverse harms associated with substance use. So just in case you're not familiar with this statistic, this is from the CDC. And from 2019 to 2021, there was a substantial increase in overdose deaths among this group. And that's primarily being driven by illicitly manufactured fentanyl. So the illicitly manufactured fentanyl is being found in substances like cocaine, press pills. So youth aren't suspecting to be taking an opioid, but it's finding its way into the supply. So this is really staggering and important to share. Amber, next slide, please. So our panelist today is going to talk kind of across the continuum of care and really thinking about what are resources that are available at college campuses and ways in which community organizations can partner with college campuses to better serve that youth and young adult population that are enrolled in college in your community. So we're going to talk about prevention, harm reduction, treatment, and recovery within this context of a college campus. So without further ado, I'm going to turn it over to our first presenter, which will be Casey Matthews.
All right. Good morning, everyone. All right, so yes, my name is Casey Matthews, and I am the director for the Coalition for Healthy and Safe Campus Communities, or what we call CHASCO, and we are a statewide coalition serving campuses in Tennessee. Next slide, please. So our mission is to connect and support our institutions of higher ed in addressing health and safety issues, campus health and safety issues. We are primarily funded to address substance use and substance use prevention and to promote mental health awareness on campus. So some of the ways that we accomplish this, accomplish our mission, are by providing professional development and networking opportunities. We provide assessment tools for our campuses so that they're able to collect the data that they need. We do provide some funding for resources and for evidence-based and evidence-informed programming, and we always want to make sure that our campuses have the most up-to-date research on prevention best practices. Next slide, please. So when we're talking about substance use prevention on campus, I just thought it was good to have some of these ideas to kind of lay the foundation with some of these topics here. So we have we want to look a little bit at risk and protective factors. We want to look at the Drug-Free Schools and Campuses Act, and then I'm also going to share some best practice guides with you all. So we're going to take a moment and look at each of these. Yeah. So when we're considering risk factors on campus, these are some of the risk factors that are specific to our collegiate environment. So you can see here, we just talked through these a little bit. So when students come to campus, they may experience an increased availability of substances and can be exposed to that increased availability for the first time. There may be a lack of, or there's going to be a lack of parental influence if they're living in the dorms, if they're living off campus, potentially even if they're living at home. There's still going to be that lessening of parental influence and oversight in their lives. When we talk about stress, so stress, particularly in the first year, can be a risk factor, and that may be particularly true for first-generation students. And then we have a perception of substance use or perceived substance use. If we're seeing our peers use substances in that first year, that kind of stage is being set for normalization there. And then if broadly we have a campus normalization of substance use, and along with that kind of a low, an environment that shares a low perception of risk, then that is going to be a risk factor. And then if a student came to campus as a current substance user. Those are all going to be potential risk factors for substance use for our college age students. Next slide, please. So then on the flip side, we want to look at some of those things that can potentially serve as protective factors. So these are some of the protective factors that we know of, and these are just a few. So there's working for 10 plus hours a week. If they abstained in high school, if they have a religious commitment that is shaping their value system, if they see,
I was wondering, I was like,
if they see a perception of peer disapproval, so they're not seeing their peers using, and then involvement in service-based activities. So we're going to come back to that a little bit in a minute, and then alcohol-free events and programming. So those are some of the things that can serve as protective factors for our students, and we're going to revisit some of those here in a moment. We talk about strategies. And also, you're going to see, you all are going to receive these slides, and you're going to see the links to some of these hyperlinked on the slides, so you can actually go and read more about that after today, if that's something that you'd like to check out. So then we have the Drug-Free Schools and Communities Act. So drug-free schools, quote unquote, requires institutions to curb harmful and illegal substance use by distributing a comprehensive policy, enforcing alcohol and other drug-related standards of conduct, and implementing strong prevention programs. So schools must also publish a biennial review of their alcohol and other drug policies and programs. And it's important to note that even though the guidelines have not been updated since 1989, any school that accepts federal funding must comply with the DFSCA. And so that means that they are required to have a substance use prevention program on campus and to report back about it. And you can see there's a link down at the bottom. And so again, that's where you can check out more about the Drug-Free Schools and Communities Act. And Edgar 86 is the section that pertains specifically to institutions of higher ed. All right, next slide. All right, so these are just some best practice resources that I think it's helpful to know about. So the NIAAA College AIM lays out our best practices for alcohol use prevention, and they are broken out by individual and environmental strategies. What's really helpful about the College AIM is it also includes the cost of the strategies, as well as the effectiveness and the research that goes along with each intervention. So prevention with a purpose. This is a strategic planning guide for preventing drug misuse in college students, and gives some really good foundational information about prevention best practices and setting those in a collegiate setting. Definitely something that can be a good tool. And then the Maryland Collaborative in general is a great resource, but they've created a guide to best practices. We'll talk about it actually again later, but one of the things that's really laid out is the current research on environmental strategies, and also the strategies for campus community collaborations that are found to be most effective. Next slide. All right, so how can we collaborate and work with our campuses to address substance use prevention? Next slide. All right, so if you've ever watched the show New Amsterdam, you may be familiar with this quote. There's a doctor in the show that pretty much starts every conversation with, "How can I help?" And I will say that I found this to be a really helpful way to start a conversation with our campuses. So how can we help? What do they need? What resources can we share? And the best way to find out, right, is to start by asking and having that conversation. Next slide. So we also need to look at what the data says. So you can familiarize yourself with the data so that you have an idea of the landscape and what that looks like in a collegiate setting. I've linked a few resources here that specifically look at, among other things, they specifically look at campus substance use behaviors. So you can check those out and dig into that and kind of have an idea of what, and if you have local resources too, you know, kind of looking at that data and what it says and having an idea. And also, are there collaborative opportunities? So in Tennessee, our state Department of Mental Health and Substance Abuse Services has been hosting the Tennessee Together survey in our middle and high school schools for several years. And this is a survey that looks at substance use and mental health behaviors that is specific to our state. And over the past 2 years, we have had the opportunity to collaborate with our state on implementing this at the collegiate level. So now we're going to have data that looks at middle, high, and that collegiate level, those collegiate level behaviors. We don't have the data yet since this is our first year of full-scale implementation, but we are really excited to see where this goes. So, you know, there's just some opportunities for collaborative data sharing, for example. Next slide. And of course, when we're talking about primary prevention, a mix of strategies is always best when we're trying to impact a culture shift. So we do need to think about strategies that are across that social ecological model, and thinking about how we can be implementing both individual and environmental strategies. So keeping that in mind, next slide, please. I've laid out some of the individual and environmental collegiate prevention strategies that are in the kind of best practices category. So if you take a look at this, you can see education and skills training. How are we helping our students build the skills to not use substances, or the coping skills that they need to have in place? Screening and SBIRT, screening brief intervention, which stands for screening, brief intervention, and referral to treatment. So this is about screening and then having that brief intervention with a student. There are multiple screening tools out there. There are some that they kind of range in cost from from no cost to most expensive, all right? And the College AIM is actually a great place to look to see some of those screening tools that have actually been assessed for effectiveness. And then when we're talking about that brief intervention piece, motivational interviewing is going to be one of our strongest tools for that brief intervention part of this strategy. When we look at social norms, so how can we look at the data and then highlight those healthy behaviors that we see and kind of normalize those healthy behaviors on campus so that we can correct any misperceptions that may be at that environmental level. So social norms campaigns can be a great tool. Campus policies and addressing campus and community policies for restricting access to alcohol and substance use is typically going to be one of the kind of most effective strategies, particularly from an environmental stance. And then, we're talking today about community and campus partnerships. So there's actually an organization, I'll talk about it a little bit more in a second, but the Town and Gown, the International Town and Gown Association. So what are the ways that we as a community can partner with our campuses to address some of these concerns? And those community partnerships and strengthening those can be a really effective strategy. And then alcohol-free events and programming, as we talked about earlier, those can serve as a protective factor for educating our students and creating an environment that is substance use free and reduces the risk of initiating use. All right. So all of these types of strategies can be combined to try and change the culture to be less permissive of substance use. So, and then also just important, I know we're going to talk about it in a minute, but I just want to also reiterate that, thinking from that secondary and tertiary perspective, it's always extremely important to provide resources for students who are in recovery or considering recovery as a piece of all of this. All right, next slide. All right, so I've got some ideas here, kind of setting the stage for, what prevention and kind of best practices around prevention looks like at that collegiate level. I also wanted to share some examples and some strategies that could be collaborations and possible collaborations with our campuses. So if you take a look, you can see up here in the top left corner, campus and community policy strategies. So I again linked that best practice guide that I mentioned from the Maryland Collaborative. They really illustrate and go into the importance of those campus and community partnerships, particularly for addressing things like alcohol outlet density, placing limits on days and hours of sales, and then compliance checks for alcohol sales. They really get into how communities and campuses can can address those policy strategies from a collaborative perspective. If you look at the service-based opportunities, so many of our campuses will partner with local community partners to provide service opportunities, particularly during times that are considered high risk for substance use, like fall and spring break. And also just remembering that those service-based opportunities are serve as a protective factor, as we mentioned before, for students in terms of preventing substance use. It might seem simple, but I will tell you that the swag and educational items, so there may be things that your coalition is able to procure through grants or fundings that our campuses would love to be able to give out and to share when they're doing their educational programmings. Some things that are some examples, things like lock boxes, medication disposal kits, even just educational flyers and pamphlets, any kind of giveaways like that. Many of our campuses do not have a lot of resources in this area. So that is one way, just, if you have information that you can share for them to give out, you will most likely make a friend with that resource sharing. So substance use programming and health fairs. So this is another really big one. So how can you contribute to educational programming that's happening on campus? Like, could you provide a training during first year orientation? Could you attend a health fair, bring information? Is there a fun activity that you could bring to campus that might provide an opportunity? One example for us, we actually collaborated on a goose chase scavenger hunt a few years ago during the pandemic, actually, and we created an alcohol and substance use prevention template. And so our campuses were able to take that and use that scavenger hunt as a way to interact with students. So sometimes it could be campus only, but that scavenger hunt can also include our community partners as well. So just as kind of a thinking of fun ideas and ways to get information out. And in that same vein, kind of collaborative events, are there opportunities to collaborate on big events like drug take back opportunities, take back the night? There are things, like the community talks grants that SAMHSA offers. Are there opportunities for campuses and communities to collaborate on those kind of projects? And then, so again, party host training goes back to that concept of the town and gown partnership. So I mentioned that town and gown is a group of college and university administrators and city officials and campus neighbors who all kind of collaborate on these issues of partnership. And this particular link takes you to a party host training, which helps teach our students how to host safer parties. And this link goes to a training that is free and open to anyone who would like to use it. And it was created in a partnership with the Higher Ed Center for Alcohol and Drug Misuse Prevention and Recovery. So that's just a really simple tool that you might actually be able to use and partner or bring to your local campus. So then just a couple more, we're thinking about social norms campaigns. I mentioned that earlier. Do you have data that campuses might be able to access? Or is there an opportunity for a shared social norms campaign? Again, thinking about that town and gown relationship, is there a way that you might be able to collaborate on a larger scale social norms campaign? Just a thought. Faith services or engagement, again, those opportunities to be involved with their faith community can serve as a protective factor. And then lastly, and probably, most of us are thinking about funding, right? So is there a way to collaborate on grant and funding opportunities to address campus substance use prevention? Because the more folks we've got involved, obviously, the more reach we're going to have. And yeah, so that is, and then, yeah, next slide. So yeah, those are just some ideas, some kind of prevention best practice strategies, and then some ideas for ways that you might be able to work with your local campuses to implement some of those best practices. So happy to talk more with anybody. If you have questions for me, my contact information is on the slide.
Wonderful. Thank you, Casey. That's great. We are going to open up for Q&A after each speaker, just so if you have a question that's fresh on your mind, you can ask away. Feel free to unmute yourself to ask a question, or you could put it in the chat and I'll read it out loud and Casey can answer for you. We will have an opportunity to ask questions at the end as well, but want to give this time for you.
Hey, Casey, Dana Reno with Nashville Thrives here in Tennessee. I've already emailed you, but also I was wondering, we met with state representatives last week, and they're really wanting local Tennessee state data. And I was wondering if you have a great resource for that, or something you would recommend, or some data that we can share with our state representatives. And I know, as far as like Nashville goes, one of the things that's often questioned is when we do look at like overdose rates and whatnot within the county, because there's several, I looked at your thing and you're partnered with several of our universities here in Davidson County, how often that is college students that may not actually be from here. Just there's lots of questions about data that I was wondering if you have access to.
Sure. I mean, I'd be happy to talk to you more in depth, so maybe we can set up a time. But I think, are you talking about substance use, kind of substance use behaviors? Is that substance use and mental health? Okay, just making sure. So I think the Tennessee Together survey that I mentioned, if you're looking for that K through or middle and high school data, that is going to be the best resource that is Tennessee specific. And then for so if we're looking at the collegiate data, one of the things that we have found, we do have some Healthy Minds survey data that our campuses, so our campuses are receive funding from us to implement the Healthy Minds survey. They have the opportunity to implement once every 3 years. So I do have that data that I'm happy to share with you. And we are probably just a month or so away from getting our first Tennessee Together survey report. And I think if there's preliminary data that you're looking for, we might be able to ask for that too. So yeah, happy to talk about that. But in general, it is difficult to find for us anyway that that Tennessee collegiate use specific data, and that's why we kind of saw that need with the higher ed survey, and we are working to fill that gap. Yeah, absolutely. And there is consequence data included in that Tennessee Together survey. When we developed the Tennessee Together higher ed survey, we crosswalked the NCHA, the Healthy Minds, and then also an individual, a state-specific survey from our partners at Partners in Prevention in Missouri. So we kind of looked at all those and pulled that information together. Great question. I look forward to talking to you.
Other questions? Casey, do you feel like there was a strategy that has been best suited for the collaboration between community partners and college campuses, or
sure,
most effective, easiest to do? Might be different.
I think that's a great question. Yeah, I think the education and skill building, well, I think the education and skill building is one of the kind of best practice places where there's a lot of opportunity for collaboration. When a community partner has a skill or a skill-based training that they can share with students or peer educators, I think that's really it's really helpful, because you're bringing something to the campus that they need, and also kind of taking that load off of their shoulders, because they can bring in a partner who's going to help lead that training. So for example, things like bystander intervention, skill building, mental health first aid, QPR trainings, overdose trainings, all of those kind of skill-based trainings that our community partners are experts in can be a great way to collaborate. One example, kind of a specific example, a couple of years ago, one of our four-year institutions actually brought in their local community coalition to lead a session with their Greek life on how to host a safe party, kind of that party host training, and, included things like standard drink sizes and bystander interventions, that kind of thing. So that was a great community campus collaboration. So those are the kind of things that I think can be a great place to start.
Wonderful. Thank you.
Yeah.
Anyone else? Well, there is opportunity to ask more questions at the end as well, so we can continue on. And we will start with Dr. Lorian Eldridge and Reese Hyatt.
Right. All right. I hope everybody can hear me. Thank you so much for inviting us to come and talk today. This is such an important topic. We're going to really focus, Reese and I are going to really focus on harm reduction and fostering community support. And as Kate said, I'm Dr. Lorian Eldridge. I'm at East Carolina University. Reese?
I'm Reese Hyatt. I'm in my junior year ECU marketing major, and I'm president of Team Awareness Combating Overdose.
And we're going to be talking about the taco in just a few minutes. But first, what I'd like to do is just kind of talk, next slide, please, is talk about what is harm reduction. So harm reduction is an evidence-based approach that's critical to engaging with people who use drugs and equip them with supplies and tools and information to help create positive change in their lives, hopefully potentially saving a life or decreasing disease or infection. And I think the really big piece about harm reduction that I like to focus on is that we meet the person where they're at. So it's not my values, beliefs, or morals towards substance use. It is just meeting them exactly where they're at. And that will look different for each one of our students that we're working with. I just want to give some examples of what harm reduction may look like. It may be overdose reversal education, syringe exchange programs. It may be a public health vending machine, or distribution mechanisms for fentanyl testing strips, safer use kits, wound care supplies, or even naloxone. We can go to the next slide, please. So harm reduction on college campuses. So Dr. Egan shared a little bit about the risk, and I'm going to share a little bit why this is so important that we have harm reduction on our college campuses. So college students are incredibly vulnerable to the risk of substance use, abuse, and its health impacts. Research shows that drug use is highest among the ages of 18 to 25. And really during the last decade, there's been a report of increase of using illegal drugs and or prescriptions among college-age students. And students often are reporting utilizing substances to cope with stress or emotional turmoil, as they frequently experience emotional impacts from various obstacles when coming to college. Next slide. There's some key risk factors that I want to just point out here among college-age students. So one is being a member of a fraternity or a sorority. So a while back, we conducted interviews with executive fraternity members on campus, and we found that our participants acknowledge that there's a high risk for a possible overdose on campus, and they really desired harm reduction supplies, specifically naloxone. And they felt that this should be accessible to all their students and all their members of their fraternity. Some of the chapters that we talked to had identified this as a major concern and had already previously brought in people to do trainings for their membership and began carrying naloxone on their own. Another risk factor is the low perception of harm. And so as we noted on the previous slide, that students have progressively reported an increase in use of misuse of prescription medications such as Xanax, Adderall, or opioids. And often prescription medications are viewed as less harmful as other substances. And so they feel that there's a lower risk in engaging with those substances. Though students, as Dr. Egan had mentioned, students may not realize that these medications may be a pressed pill and may not actually be the real a real medication. Peer influences and time of transition really blend together. So many times this is the first time a person has lived on their own. They're meeting and making new friends. They're experiencing a new level of freedom that they haven't had before. And all of these things can increase risk of substance use. Additionally, poor academic performance or history of binge drinking can also be risk factors for developing a substance use disorder. Next slide. So ECU has actively advocated for a range of harm reduction initiatives aimed at our student body. And so I just wanted to talk a little bit about those. So one of those is that we offer naloxone for free at our student health center, and they also get an overdose training when they pick up naloxone. We do have a collegiate recovery community, which is designed to provide educational opportunities, personal development, social enhancement for students' recovery from mind-altering substances. And the goal really is to support the student in abstaining from substances within a recovery-based model. We also have Campus Recreation and Wellness Center. In this department, within that department, they have a health and well-being, and they hold events on campus for all students, which we're going to talk about a little bit more detail in the upcoming slides, such as a You Matter resource fair, Safe Spring Break, Sober Tailgate, Halloween Safety Fair. And these events really are developed to educate students on topics such as mental health, substance misuse, and provide harm reduction resources. And we also have our Team Awareness Combating Overdose. This is known as TACO for short. It's a student organization, and our mission is to combat overdose by fentanyl poisoning among young adults. And TACO participates in campus-wide events to hand out overdose fentanyl testing strips. They direct students to the student health services to receive Narcan. And TACO also provides education to students on substance use and harm reduction using non-judgmental and neuroscience-backed research via our social media. Next slide, please.
So to dive more into Team Awareness Combating Overdose, also known as TACO, you have it nationally, and then you have your local chapters, such as ECU chapter. Nationally, TACO has distributed over 30,000 fentanyl testing strips nationwide. There are currently 10 chapters across the country, and TACO also runs an ambassador program that sends students out to large music festivals. And at these festivals, they have Narcan and fentanyl testing strips. Actually, last year at Coachella, they were able to save a life of someone overdosing in the crowd by administering Narcan that they had on them. And as for the local chapter here at ECU, we've distributed over 300 fentanyl testing strips. We've also handed out over 300 pirate safety slips so students can get Narcan for free. A pirate safety slip is just a little slip you can take to the student health services to hand to the pharmacist to get your free Narcan, to get trained on it and everything. And we're also a part of multiple tabling events where we talk about harm reduction and inform students of local resources such as where to get fentanyl testing strips, where to get Narcan. And at these tabling events, we also have a board that we bring with us out there that has a lot of good information on it. It has 6 different flyers. The first one is about TACO and our mission. The second one is what is fentanyl and its impact. The third flyer is what you should know about overdose and Narcan. The fourth flyer is about the Good Samaritan Law in North Carolina. The fifth one is about TACO's impact and opportunities. And then the sixth flyer has QR codes with our social media and stuff on it. That way people can go and find our Instagram and get some more information and find out more about us. Next slide, please. So pictured here are all of ECU TACO's events over this past school year. We're going to go in order, starting off with Get a Clue. Get a Clue is an event for freshmen to get to know the clubs and organizations on campus. We had a sign-up sheet for people who wanted fentanyl testing strips, and once we had them come in the mail, we were able to give them out to the students on campus, and we gained 17 new members that day. Next up, we had our Hazing Prevention Resource Fair, which was an event for students to learn and gain more awareness about hazing. That day, Taco gave out over 100 fentanyl testing strips. And then next up, we had the Halloween Safety Resource Fair, which was for students to learn about safety precautions surrounding Halloween weekend at ECU. We had papers with information on substance use for students to use as a guide if they did choose to partake in substances. It included information on the side effects of some popular party drugs such as cocaine, MDMA, and alcohol, as well as where to find resources such as Narcan and testing strips. We gave out all the testing strips we had left for that day, which was around 30. And then next up, this is one of our busiest events of the year and one of my personal favorites, Safe Spring Break, which is for students to learn ways in which they can have a safe spring break. We actually made a spring break packet that included information on Narcan and fentanyl testing strips, such as how to use them, where to find them. We talked about how to avoid roofies and binge drinking. We talked about the Good Samaritan law in different states. We also talked about how popular spring break drugs affect you. We also listed 5 important resources to have. Those resources were Narcan, testing strips, your phone, water and food as the 4th one, and then Noonlight, which is an app that helps you get from point A to point B safely. It's like an app on your phone. If you take your finger off the button, it automatically lets 911 know your location and everything if you don't put in your code, which is a great resource to have if you're out late. And lastly, we talked about information, just about Taco, our mission, and how you can join. At the Safe Spring Break, we gave out 117 fentanyl testing strips, 60 pirate safety slips, and we gained 16 new members that day. We also had training heads and Narcan testers that students could use to practice inserting Narcan to become more comfortable with it. And then lastly, on the table, we provided overdose awareness bracelets and drink covers. And then our next event was HEP Day of Play, which was a day for students to mesh with faculty in a fun and safe outdoor setting. Taco had a hire professor table so we could raise money for Taco's combative efforts. We raised $85 that day and gave out around 20 fentanyl testing strips. And then our most recent event was the You Matter Resource Fair, which is an event that encourages students to talk about mental health and make the conversation more normalized. We gave out the rest of our fentanyl testing strips at this event, which was around 15. We had the training heads and Narcan testers at this event as well. We also had the bracelets that say I support overdose awareness, and we had drink covers there too. Something I wanted to point out was the table from Get a Clue, one of our first events, versus the table now at our most recent event, the You Matter Resource Fair. I feel like it's really shown how much this club has grown. We've been able to see what the students are grabbing from these tables, what they're benefiting from, and what they really need. Next slide, please.
And I just want to add, Taco's really student driven. And so when we're discussing what type of resources we're going to share and bring to our tabling events, we decide that from our students. So when students are asking us questions at the table, our executive and our members will bring that back to us. And so then we make sure like, oh yeah, these types of drink covers they were much more popular than these types of drink covers. So then we make sure that we're ordering and getting the right supplies that the students will actually use. So Taco is a great organization, and I'm so grateful to be a part of it. I want to just talk about some other things that we can do to engage community. So community engaging with the universities, and then also the universities engaging with our community related to harm reduction. So one great way is guest speakers. This is a wonderful way for the community to get involved. And so if you are working on a college campus and you want to reach out to your community, I would suggest reaching out to your local county or state harm reduction coalition and ask them to have somebody come in and speak to one of your classes about harm reduction. This is a great way to just start to engage with your community. And on the flip side, if you are a part of a coalition and you're interested in working with universities, reach out to your universities. You can reach out to public health the public health majors, nursing, medicine, social work, health behavior. There's lots and lots of different types of majors that are engaging with harm reduction work. And I know myself as a professor, I'm always looking for guest speakers. And I don't think that they necessarily need to be local in the sense of, you know, I'm in Pitt County. It doesn't necessarily need to be somebody from Pitt County. It might be someone from another state or even a different region that can bring some great insight and give some overview information about harm reduction. This is such a needed thing to, again, just provide information and opportunities to our students. I know that as professor, I want my students to engage with their community and I want to engage with our community. So as I mentioned, guest lectures are a great way of doing that. They don't always have to be in person. We have lots of technology now, just like today, where we're meeting virtually. So even if you can't come in person, that's fine. We will make it work. Funding for research, student organizations, and campus organizations. So funding is a great way if you are able to provide funding or collaborate on research and help support that. That is wonderful. One of the things that happened this year is that we had a family that every year in our county hosts a yearly event in honor of their son who passed away from an overdose. And each year they choose an organization that they will donate a portion of their funds from their event. And this year they chose to support Taco. And so they donated a portion of their funds to support a student organization. And this will help us to continue to promote harm reduction and gather those supplies, like we said, fentanyl test strips and you know, drink covers and other harm reduction supplies that we pass out at our events. So that's a great way and an easy way to engage as well. Also, additionally, like research really requires collaboration with community members oftentimes. So if you are a community member and you want to be engaged in a project or you have an idea, you from your center, like, we really want to know more information about this, or this would be really helpful. This is a great way to begin a collaboration and start engaging in talks and maybe potentially doing grant work together. So just reaching out to universities and see what can be designed to help you and also help the researchers as well. Internships are a great way to get involved. Sometimes I think communities that have a university can be overly impacted with internships. Oftentimes they are you know, the internships are in the community. So I recommend that even if you don't have a university in your local county or region, reach out to universities that you're interested in working with. Internships don't necessarily always have to be face-to-face. They can be virtual as well and be developing lots of different materials. I have an intern that I'm working with right now. Majority of her time is done online, and she's creating social media content for a coalition. So this is a great way for if you need some free work and the students need to do this as part of their degree. This is a great way to collaborate. And like I said, it doesn't have to be in your backyard. This could be, you know, a state away or a few counties away. It can work. Again, just if there are volunteer opportunities offered in your community and you want some resources, reaching out to academic partners is a great way to start that collaboration. I was recently talking with a group of emergency department physicians and then also first-year medical students, and they were working with our syringe exchange program in our community that serves a very wide range, basically the eastern part of North Carolina. And they are, these medical students and the emergency room doctors are engaging with individuals that are coming to the syringe exchange. they cannot provide medical assistance, but they can provide resources and talk about, how to take care of a wound and different things like that. So a great way of collaborating, and our students are really excited about it. When I was talking with the medical students, they were very excited to be able to go out and be kind of boots on the ground and be engaged with the local syringe exchange in our community. Another way is we have our local coalition has been working with our health center, our student health services, to provide naloxone. As Reese mentioned, we have free naloxone on campus. So they're assisting in providing naloxone to our student services so that students can have access to that. They also provide lock boxes to dorms so that if students do have medications, whether those medications are Adderall, Xanax, or an opioid, like let's say they got their wisdom teeth out or something like that, and they had a medication, they could lock those medications up so that it wouldn't be accessible to other people in their dorm room or in their dorm living in their shared living environments. And so they provide those as well. There's lots of ways that we can collaborate. I think that the only thing that is the limit is ourselves. And so reaching out and engaging with universities that you're interested in working with, and as universities, us reaching out to our community partners, it's vital for our students and to improve our harm reduction, not just on our college campuses, but in our communities as a whole. Next slide. And so I just want to, this is our Reese and my contact information. Feel free to contact us if you have any questions, and we'll open it up for questions.
Thank you. Please chime in if you have questions. There were several requests about the table heads or the heads for the trainings. Do you have a resource?
I could
where to get
definitely,
those?
I could get those for you. So these table heads, we use them in our first aid training. And so we just, what we kind of came up with it, we're like, it'd be really good if students could just see what it looks like, that it's so simple. And so we were chatting about it and we were like, oh yeah, we have these, little heads. And so we bring those now. And then we actually, what we did at our last training, Reese was a genius of doing this. She just put the Narcan in the nose. So it actually, students are like, what's going on? And so they stop by and look, and then we do a brief training of how to use Narcan right at our table. This is how you use it. So I can get that resource, Kate, and I will email that to you.
Sounds great. Was that from Dewey? Was it
Yes.
from okay. So it's essentially from the group partner at the college that does the CPR training.
Right. And they
So
do, and in their CPR in the first aid CPR training, they do Narcan training for everyone that comes through as well.
any other questions?
Can I ask a question when talking about harm reduction? I know with the university students that I'm working with, one of the concerns is getting home safely from going out at night. We're trying to look at ways, because we are a provision, but we want to meet them where they're at. So talking in terms of harm reduction with like how to be safe when you go out, and the big one is how to get home safely, especially with the young women that I'm talking to. They don't even feel safe using an Uber. And so I'm trying to identify some support networks to share with them.
So Reese, will you put in the chat that one resource that we share with our students here? And this is an app that a lot of our students use, where you have to keep your finger on the app. Reese, you can share exactly what it is. You're very familiar with it.
So yeah, it's a mobile app that you can have called Noonlight, and it basically has just like a little white circle on it. And when you're walking at night, I use it almost every night. It's a great resource to have. You just hold your finger down on it, and then say you get to your destination, you take your finger off, and within 10 seconds, you have to put your own code that you make. And if you don't, the police will automatically be sent your location and notified on where you're at. And I think that's a great resource to have. Another one I wanted to add for getting home, I know at ECU we have something called Beep, which is basically like a student Uber. I'm the same way. Sometimes I don't feel comfortable taking an Uber or a Lyft. It helps with the Noonlight app, but also Beep, I think is great. It's just like a Facebook group. I know a couple of different colleges have it. But you can do it where it's girls only. You can only be admitted into the Facebook group if you are enrolled in that college. And that's a great resource to have too, I think, as well.
One of the things that I do as a professor is that if it's a key time that I know that students are getting ready to go and have a party, a big game or different things like that, I will send an email, and I also say in class, if you're going out tonight, figure out how you're getting home right now before you go out. And I would send that in my class email as well. And I put in just some harm reduction things like, about similar to, as Reese said, like if you're going to be mixing substances, how are you going to, and I really focus on like how you plan how you're getting home, figure out who you're going, how you're getting home before you go out. So those are things that faculty can do. And just normalizing that conversation. I had a lot of students say, oh, I didn't even really think about that, especially when I was teaching a freshman level class. That was something they just never even thought about, and they're like, you're the only one that talks about this. And I'm like, well, let's keep talking about it, So sometimes it's just opening that door where they feel safe talking about it. And then they just, and then they're able to figure out their plan beforehand.
Yeah.
Excuse me, I have a question.
Yes.
Can you hear me okay?
Yes. Hi.
Hi, my name is Carlisle. I'm based in Colorado. I work for an LGBT organization. And along similar lines as what y'all were just talking about, I'm curious, how does Taco address harm reduction in terms of consent and, around, trigger warning, but rape culture on college campuses? I feel like that is also part of harm reduction practice. And how is that addressed with like sororities and fraternities? If you're already working with them, I would at least hope that there's an overlap there because there is such high rate of SA on college campuses.
Reese, do you want to take it? You want me to go?
You got it.
Okay, so Taco really focuses, our focus is really focused on overdose prevention. And so, but ECU, our college campus, and a lot of these events that we're talking about, there's other organizations that are addressing those concerns as well, because it is something that, like you said, it's a lot of times they go hand in hand. And that's what I love about how ECU is setting this up. So like the Safe Spring Break, that event is so amazing because we have all of these different groups and we're all working towards creating a safer, healthier environment for our students. And so we might not be addressing that specific area because we're really focusing on, like I said, fentanyl test strips and Narcan and preventing the overdose, but the table 2 doors down is doing that, right? And so that's one of the things that I think is really important. And those tables we continue to show up and continue to talk about our messages. And but they're getting those messages. Often what they do is they do kind of a bingo card, and so they have to go to each of the tables, and then they get some type of prize or thing at the end. And so they're getting all of those messages as they go through all of those tabling events.
Awesome, thank you.
Mm-hmm.
I have one more question if you don't mind.
Oh, I don't mind. I take as many questions as you guys want.
My camera is not working, but I am here. I'm actually a student at Southern New Hampshire University, so I'm way up north. And I thought it was really interesting because I just presented on the use of illicit study drugs on college campuses, that even in a state like New Hampshire, which you don't have to be from here to know that our opioid levels are through the roof, they don't provide a safe for dorms for any student who has a medication. So I
Right.
really appreciate you sharing that resource. So hopefully we can get Southern New Hampshire University in the loop of that, because there are students that are looking for that. And I just think it's really cool that you guys are like implementing, and it gives me hope that like we can eventually get there as well, right?
Right. And is that Kaylee? So the lock boxes, they're pretty reasonable, and I purchased those with grant funds with our harm reduction coalition. So when we are working with them, we're sharing with the students. They're just individual, they just hold just a little bit of medication, right? But it's such a great way to promote prevention and decrease harm, right? And it gets them thinking about those things like, oh, wow, like this could be a risk, and there are students that are, have legitimate prescriptions that need to be, that other students may be looking for, right? And so we want to make sure that we're decreasing harm and locking those up. We come into college, each state and each college is a little bit different because they have different rules regarding duty of care and what they can do and what they can't do. But what we can do on an individual basis is we can promote safety in our individual world. So if a student wants to carry Narcan and have their medications locked, they can sure do that. And we want to promote that and we want to support that.
Awesome. Well, thank you so much for just like being the example I was looking for to tell all my administrators.
Yeah, and if you want, grab my email and I can send you the company that we order from, and they're really reasonably priced.
Awesome. Thank you so much.
Mm-hmm.
So we will move on. I do want to share, I dropped some resources in the chat as well. So the Noonlight, I dropped the link. I also included the story about the ride promotion at ECU for BEEP. The Taco National Organization link. So if you want to start up your own local organization. And then I dropped in a Walmart lockbox. So if we have more questions, more time at the end after Annette gets to share about collegiate recovery, we can answer more questions. So thank you all.
I guess I can go ahead and start now since my slides are up. So my name is Annette. I am over here at Southeastern Louisiana University, and I also serve as the Southeast rep for the Association for Recovery in Higher Education. I am lucky to host a collegiate recovery program on our campus. We have done so, it'll be 5 years now that we'll have collegiate recovery. We were able to implement in fall of 2019. I also work with a coordinator for our collegiate recovery program as well. So that is me. Okay, so next slide. So I wanted to tell you basically, I don't know what people's orientation is for collegiate recovery, but just kind of talk a little bit about what this is. This is fastly emerging. I think we have over 170 programs nationally now for collegiate recovery. I put together a little statement from the SAFE Project, which if you haven't familiarized has yourself with SAFE Project, they have tons of resources. They're out of Colorado, but basically universities historically have not been great for students involved with substance misuse or in recovery. So their quote is, students should not be forced to choose between their recovery and education, whether it's substance use or mental health challenges. These struggles can derail a student's success and well-being. They can claim a student's life. Yet we've seen countless of students disposed by systems that limit their focus to preventing initial use, intervention, and punishment. But thankfully, I believe that this culture is changing. So next slide, also another big resource is the Association for Recovery in Higher Education. where they term collegiate recovery is a university program that includes a supportive environment within the campus culture. CRPs reinforce the decision of recovery every day. It's designed to provide an educational opportunity alongside recovery supports. I will tell you, our program, and I believe ECU's as well, is very much involved in harm reduction. So we do have a collegiate recovery program that is abstinence-based, but with that program or out of our office, we also host Narcan training, as well as a lot of open support groups for people who I like to call sober curious. So they're involved in the pathway to recovery, but they're evolving in their path. So most of our supports meet students where they are, and we welcome students at whatever stage of substance misuse they're involved in. So let's see, next slide. And I think we've kind of covered this a little bit before. We know that over 25% of college students in the U.S. meet substance use criteria. We know that we haven't done such a great job in promoting or inviting people into recovery, and that I think we've done better work when it comes to depression, anxiety, mental health, suicide, than really creating this open path for people to come into recovery and having those conversations no matter where you are. So let's see. And I mean, college students are traditionally, despite meeting criteria for substance misuse, it's still very difficult for help seeking on a college campus to pursue help for substance misuse disorder, whether that's due to stigma or lack of resources on your campus, or not really knowing what the resources are. That seems to be ongoing. So the next slide really talks about why of collegiate recovery. Oh, I must have jumped over here. Hold on a second. I was going to say, let me talk more about collegiate recovery. So 92% of our students engaged in CRPs remain in recovery in college. More times than not, in fact, I was going through our data yesterday. We have very rare do our students have a recurrence of use while they're engaged in a collegiate recovery program. And then 90% of our alumni continue to grow into professionals in recovery. So cost effectiveness when it comes to collegiate recovery, it typically saves the institution about $11,000 per student. Students who engaged in line of recovery will probably easily disclose that they probably would not have stayed engaged in higher education if it was not for collegiate recovery and the supports offered on campus. And of course, it saves the broader community over about $3,000 a year additional for life as that person stays in long-term recovery. So what was our story? How did we get here? I've engaged as a campus professional for over the last 20 years. I was a part of our community coalition, which is the TRAC Coalition for Alcohol and Drug Prevention. I was also the, substance abuse person at the University Counseling Center. I'm also a person in long-term recovery. So in probably about 2017, I was approached by a treatment center that said, hey, there's this opportunity for you to write this Transform Youth in Recovery grant. And at that point, I had many students who, not thousands of students, but I had students had come through the counseling center that were in recovery. They had had some kind of treatment. They identified as in recovery with zero support on campus. So basically the only, at that time, support that was offered for a student in recovery was once a week counseling, which was really not what they needed. They really lacked a community of like-minded people on campus, and really had a hard time finding that community. I never forget I did have a student who would tell me, she's like, I feel like I'm too bad for the good people and too good for the bad people. And I just don't know where I fit on campus. So in 2019, we were able to get that grant. We were offering support meetings. Of course, we had support of our community coalition at that point. We also had the support of our Board of Regents and our University of Louisiana System for Education. We were able to launch in 2019 and acquire space. So if you're not familiar with collegiate recovery programs, typically, your collegiate recovery program should have at least a coordinator, space, and some kind of programming to be called a collegiate recovery program. 2019, we also started looking at harm reduction and events around recovery, which we incorporated our track coalition with that. So we would do like Recovery Month. We would host Hunt for Recovery. We would do health fairs and invite our community partners on campus to help spread awareness or give information about what recovery resources was in our community. And then here we are in 2024, where we've now engaged with our Office of Behavioral Health for Louisiana in, I believe it's a $1.3 million grant process to expand collegiate recovery to 5+ universities in Louisiana, including community colleges, public and private HBCU universities as well are involved in that project. We've had a space upgrade. We've expanded harm reduction to include things like Narcan trainings, allies in recovery trainings, as well as expanded our support group. So we on our campus participate with what's called the core survey every 2 years. And that's part of our biennial review process. And when we participated with the core survey, we were able to add the question in that core survey of, are you a student that identifies in recovery? Are you in recovery with support, without support, or I'm just not in recovery? And we came out to match what was the national stat for students in recovery on college campuses. So we met, like, I think we identified, I think it was like 250 students said that they were in recovery on our campus, and about half of that number was that they were on our campus in recovery without support. So the other cool thing about collegiate recovery is that we speak recovery on our campus, which is so, I think, the neatest thing. You can see it on our digital boards, our social media. There's opportunities if a student is sober curious to engage in recovery. And I'm assuming that we're reducing barriers to get folks in on that path. So just some of the outcomes that we've had so far is we've had 11 graduates. Our GPA is consistently super crazy good. I don't think we've ever really been below a 3.5 cumulative for our students. We also have a allies list for those students who are sober curious that we send out newsletters and those types of things. So when we're looking at how community coalitions can engage in collegiate recovery, I'm on the next slide. Okay, sorry. And I don't think we're, I don't think our campus is the exception in that, university Department of Student Affairs staff tend to wear too many hats at times. So when there's a community coalition that can help us collaborate with events or come on campus, I mean, we absolutely adore that. So what we've done the most is really support access to Narcan. So most all of our alcohol and drug prevention events on campus, whether it's our mocktails event in the fall or we're doing like an acknowledgement day, collegiate recovery week, those types of things, we will do an advertised Narcan distribution. And that is typically when we involved our community partners on that. Collegiate recovery programs, ours, I don't know if is really unique. We do offer scholarships to our students. In order to get scholarships, we have to do fundraising. So our community partners help support our fundraisers. Southeastern does host a Christmas market, which this year will be November 2nd if anybody needs to come do some holiday shopping. But that is how we raise our programming money, our scholarship money. And so any coalition that has extra hands and feet for fundraising again events, that would like really helps us grow. And then what we've seen is decreasing barriers to recovery is pretty important as well. One of the things I think is been kind of a little bit of a challenge working with community coalitions is sometimes I feel like the mindset is just a little different in that community coalitions may approach more of please don't start using. Where our approach is kind of like, hey, you know, if you've started using and you're looking for recovery, you know, we have resources here for you. So it's been, I think that's been kind of maybe one of the growth areas is really looking at, where are some of the prevention efforts, maybe sometimes creating barriers because they're using some old language towards alcohol and drug use. And then I guess the last thing that I was going to highlight was just support campus programming. Again, we just appreciate any help that we can get typically on college campuses. So the last but last, I put resources for people who are interested in learning more about what collegiate recovery is. I think, you know, community coalitions can do a lot to ask themselves, like, what is it about my community that would help somebody sustain recovery? And collegiate recovery programs, you know, for college campuses, it kind of answers that question for college is like, universities had to ask themselves, if we want students here that are able to sustain their recovery, what environments are we creating for those students that would really help foster sustained recovery? And I think community coalitions can also ask themselves that same question is, okay, once people acknowledge that they have an issue with addiction or substance misuse and they get in recovery, what is it about my community that would really help sustain recovery? So I mean, it's a fascinating journey that we've been on. But anyway, resources can be, I didn't do hyperlinks on this. I guess I need to catch up with technology, but the Association for Recovery in Higher Education has tons of resources. They have a map on there, so it shows you where in your community or where in your state there is collegiate recovery programs. The SAFE Project out of Colorado, again, they have like tons of resources. So anyway, I've listed also some of the more established collegiate recovery programs on my resource list as well that y'all can check out. But I think that's all I have for now. So if anybody has any questions, please let me know.